the most interesting aspect about the bicuspid valve disease, or bicuspid aortic disease actually, is that it's associated with early onset, relatively early onset aortic stenosis, infective endocarditis, and aortopathy. These bicuspid aortic valve disease patients are much more prone to develop aortic dissection and aortic aneurysm. And we try to understand why they're much more vulnerable to develop those aortic diseases. But before going into that, we first need to understand a few basic concepts about the bicuspid aortic disease. Normally, our aortic valve has 3 cusps, but some unfortunate individual, they're born with 2 cusps in their aortic valve. And if you note that out of all the 4 cardiac valves, usually other than mitral valve, all usually have 3 valves. But exception is mitral valve, which has 2 valves, which I mentioned. But the aortic valve normally has 3 cusps. But if we are born with 2 cusps, that condition is known as bicuspid aortic valve. And what is the major problem with this is that normally left ventricle is a high pressure zone, and the aortic valve has to handle a lot of hemodynamic stress, hemodynamic pressure. So usually this pressure is shared by 3 cusps of the aortic valve. But in the patient of the bicuspid aortic valve, as it has need to be distributed, this pressure need to be distributed by in the 2 valves, that causes a lot of wear and tear effect, hemodynamic pressure and stress, fibrosis and calcification, particularly the dystrophic type of calcification. And that can cause aortic stenosis, that means the narrowing of the aortic valve at an earlier age. Normally, the degeneration associated aortic stenosis usually occurs in 70s and 80s, usually up to 60 plus. But usually the patients of bicuspid aortic valve disease that develop aortic stenosis, that means the narrowing of the aortic valve, by the age of 50s and 60s, a decade earlier. That means 10 to 20 years earlier compared to the usual senile aortic stenosis. That's one of the key concepts that you need to know. Now, bicuspid aortic valve, by the way, is considered the most common congenital cardiac disorder. And it roughly affects 1 to 2% of the global population. And this disorder is mostly sporadic, but could be associated with a lot of syndromes, particularly, I think I've read that Turner syndrome is the most common congenital cardiac anomaly, even more than coarctation of the aorta. It has also been associated with Williams syndrome, which is also associated with supravalvular aortic stenosis. And particularly in some cases, some familial clustering has been seen, which they are associated with Notch1 gene mutation, loss of function of this Notch1 gene on the chromosome 9, which has been mapped on chromosome 9. Now, coming to its complications of this bicuspid aortic valve, it's the most common complication obviously would be the aortic valvular abnormality, particularly the aortic stenosis and aortic regurgitation. And as I mentioned, aortic stenosis is very much important, and it compares a little bit earlier than the usual degeneration associated aortic stenosis, which is seen due to the aging. And aortic stenosis means that normally the aortic valvular opening is roughly around 4 centimeters square, but in this condition, aortic stenosis, it becomes 0.5 to 1 centimeter square. That means it narrows down. And as in stenosis means that due to this narrowed opening gap, the heart has a harder time to pump out, eject out the blood from the left ventricle to the aorta. That is the key problem in the aortic stenosis. And aortic stenosis, by the way, please remember that the 3 key causes. One is senile degeneration associated aortic stenosis, which results in calcification. And also this is also associated with this condition, which I mentioned, as the bicuspid aortic valve. And it's also sometimes in certain part of the world, it could be associated with rheumatic heart disease. And this condition, bicuspid aortic valve, is also associated with aortic regurgitation, that is the leaking of the blood via the aortic valve. That is also possible and seen in some patients. Bicuspid aortic valve is also a known cause which can precipitate infective endocarditis. And why infective endocarditis occurs, that is, the concept is simple, because as the aortic valve is damaged because this wear and tear effect is much more prone for this damage, this bicuspid aortic valve. There could be endothelial injury, and over the top of this endothelium, there could be deposition of the platelets and the fibrin, initiating the process of the thrombus or the vegetation formation in cases of infective endocarditis. And a particularly key thing that you need to understand about this bicuspid aortic valve, that these people are much more prone to develop aortopathy, that means some pathology of the aorta. And this is seen due to the cystic medial necrosis of the particular the ascending aorta. That means this term, I think you have read cystic medial necrosis also in Marfan syndrome. And what is the meaning of this term, cystic medial necrosis? As the name implies, there is a media, that means the tunica media, the middle layer of the blood vessel wall of the aorta. There is some changes, degenerative changes are seen. That is, elastin gets degraded, and that elastin, those spaces where the degeneration of the elastin is occurring, that gets replaced by some proteoglycans. And those areas appear cystic. So some cystic looking appearing area due to the elastin degeneration in the media part, because there is a necrosis occurring in that area. That's why this term is called cystic medial necrosis. And cystic medial necrosis has been seen in the aorta of these individuals, which is the cause is not known, but is thought to be genetic. So that makes the patient of the bicuspid aortic valve much more prone to develop aortic dissection, and also they can prone to develop aortic aneurysm. Aortic aneurysm means that there is a localized abnormal dilation in the wall of the blood vessel. That is the idea of the aneurysm. And they're also much more prone to develop aortic dissection. Aortic dissection means there is another false lumen created due to the tear in the intima. So the blood would also flow through the wall of the aorta, creating lumen within the lumen, dissecting the wall, the vessel wall of the aorta. That is aortic dissection, which can result in catastrophic complication also. And this is also the reason why the Turner syndrome patients can develop the aortic dissection, because Turner syndrome patients are associated with bicuspid aortic valve, and bicuspid aortic valves are also associated with this aortic complication. So these are the key concepts that you need to keep in mind about the bicuspid aortic valve. So what I mentioned about the bicuspid aortic valve, that key concept in a nutshell, that normally our aortic valve has 3 cusps, but some people are individually they're born with 2 cusps, and this condition and the complication associated with that, they're called bicuspid aortic valve. Bicuspid aortic valve, though it's a congenital disorder, and many consider this the most common congenital cardiac disorder, affecting 1 to 2% of the global population. And this is also more common in the males they have seen. The ratio could be 3:4:1 from male to female. And that's a congenital disorder, mostly remains asymptomatic. It's sometimes detected by echocardiography accidentally, which is done for some other purpose in earlier age. Or if there is a history, family history, you can look for that and you find it out. That is one possibility. And usually they present at a later age, presenting in the 50s and 60s with aortic stenosis, which is where the normal aortic stenosis usually associated with senile aortic stenosis, which usually occurs a little bit late, in the 70s and 80s. After 60, this one occurs 1 decade or 2 decades earlier. It can also be associated with aortic regurgitation, and it's also particularly associated with complication of infective endocarditis, and a very important complication is aortopathy. That means some complication of the pathology of the aorta. Particularly, these patients are 5 to 9 times more prone to develop aortic dissection. So these are all the key concepts that you need to know about the bicuspid aortic valve. And this is all we discussed in the InstaLecture number 107. We'll meet again in the InstaLecture number 108. Thank you very much.